Okay, that's the conclusion of our delegations for this morning. It's moved by Councillor Nan, seconded by Councillor Beattie to receive the delegations. Thumbs up for me. Okay. That carries 12-0. I'll recognize Councillor Kretsch. You wanted to speak to an item?
I want to speak to that item, but I was slow, and it's okay. It doesn't change my vote or change the debate. It was just that I was a bit slow in indicating. I just wanted to add the Easter egg excitement here because we talked a couple times publicly recently about, well, what's the impact if we don't receive a delegation? There was a conversation we had in public. I thought I'd point this out, that if we didn't receive today's delegations, then the presentation that was included wouldn't be added to the agenda. So I just wanted to say that out loud, that that actually is what happens, because I know a bunch of us talked about it publicly and just wanted to flag that. So that's the consequence. Anyway.
Thank you, Councillor Kretsch. Any further comments? Seeing none. Okay, we have a single consent item, I believe, on the agenda. If I can have a mover and a seconder to put the report, which is the 2023 Hamilton Community Heat Response Plan, BOH 23019 on the floor, moved by Councillor Kretsch, seconded by Councillor Francis. And we have a vote on that now or after?
It'll just be open for discussion.
Thank you,
And
sir.
I do have, just because Jessica hasn't put it up yet, Councillor Kretsch is on the speaker's list.
Okay, thank you. I'd just like folks to know we have Mr. Kevin McDonald, who is the Director of Healthy Environments, here to introduce the report. I'd like to do that, please, with an overview, and then we'll go to questions. Thank you.
Through the chair, Kevin McDonald, Director, Healthy Environments Division, Public Health Services, to members of Public Health Committee. The report before you was prepared following queries, pardon me, from various councillors to the Office of the Medical Officer of Health, specific to plans for the 2023 summer season specifically, but with extreme heat in mind in terms of where we're at with planning. Our office assumed carriage of the community response planning for the city this past spring. And the report is designed in such a way to signal what the heat response plan looks like, some of the review that's been carried out early days so far, highlighting the various city departments, divisions, and community partners that are involved in that current plan. And then further to signal work that Public Health Services, in concert with other city departments and divisions and community stakeholders, is indicating it will undertake in the coming year, leading into the first quarter of next year. I understand and appreciate that much discussion this morning has been centered on a maximum heat bylaw. That was certainly within our sight lines for that work, including such things as maximum temperature thresholds, et cetera, that would be examined by our office. There is an appendices to the report that outlines the various tactical components of the community heat response plan for 2023 and signals again for 2024 that various different components through the work that will go on, and I'm sure that will be directed here, will come forward for 2024. I'll turn it over to Dr. Richardson if she has anything further she'd like to add.
Nothing further, Madam Chair.
Thank you, Director. Thank you, Dr. Richardson. Now to questions. I recognized it'll be Councillor Kretsch followed by Councillor Nan. So far, Councillor Kretsch.
It's my intention to put a motion on the floor today to address at least one, but if not more, of the requests that have been made and getting us to an adequate temperature bylaw, but didn't want to interfere if there were questions before that people wanted to ask. If Councillor Nan or anyone else in the speakers just want to ask questions, I can go at the end. Question, okay.
Okay, thank you very much for notice of that intent. If I could recognize Councillor Nan, please.
Thank you. I appreciate that through the chair and also Councillor Kretsch. The question that I had was related to drinking fountains specifically. And in the action plan, it itemizes parks and cemeteries under public works will extend access to water fountains and splash pads. There was a question that was raised in the community, particularly this April, as we experienced the heat wave in April, and many residents turning to the fountains in our parks and finding that they were turned off, and inquiries about whether or not we might be able to activate the water fountains, not based on a timeline, i.e. Labor Day, or no, Victoria Day, or whatever the date is, Manager Bunn, but specifically if we could find out what would it take to turn on the water fountains, or is there ability to leave them on year-round? I understand from a freeze-thaw cycle perspective, not all of our infrastructure is prepared for that, but there is inquiries from the community about the possibility of turning on water fountains earlier and having it triggered by temperature versus by season, through you.
Thank you. Manager Bunn, if you could introduce yourself. Thank you.
Through the chair, Manager Bunn, Kara Bunn, Parks and Cemeteries. I have looked at this in detail, and it isn't related to a specific date, the turning on of the fountains. We really do look at temperatures. And this April, we had an unusually warm week. However, the next week we had some freezing temperatures. So because of that, we were unable to turn them on as early as we would like, because we have to protect the infrastructure from freezing, as you've noted. What we could look at for future is any of the washrooms that are winterized. Potentially there could be an availability of a bottle fill or drinking fountain in the washroom building, but our outdoor fountains are not currently set up to be able to be available all winter long. Those lines would freeze.
Through you, Chair, just a supplemental. So, Manager Bunn, you mentioned that in April we had the heat wave there, and are we able to turn them on and off? Is that process a lengthy one and a complicated one, or is that something that we can control rather quickly?
Through the chair, it is a complicated process because the fountains, when they are, it's also expensive. So we have a contractor that comes in and does the winterization in the fall, and the lines are filled with a non-toxic type of antifreeze that keeps the lines from freezing, and they're blown out, and we ensure that there's no water in the line that can freeze. And so in the spring, they come in and they remove all of that product, they blow them out, and they run the lines to clear the water so that the water is fresh and available for use. That is a fairly lengthy timeline. We also have close to 100 fountains throughout the city, so it does take some time to get them all closed down and then open back up.
Thank you. And final question on this topic, through you, Chair, as it relates to the current practice of turning them on. And you said it wasn't a specific date related, it was related to temperatures. What is the protocol for turning them on?
Currently, we look for at least 2 weeks of double-digit weather overnight, and then that signals to us that we are not at risk of those lines freezing.
Councillor Nan. Thank you, Manager. Councillor Nan.
Thank you. Sorry, I just needed a second there.
Yep.
The solution of looking at winterized facilities, having a drinking fountain that could be operational, would that be operational 12 months out of the year, or would there still be any limitations?
Through the chair, we would have to consult with our facilities staff on that and come back with an answer.
Thank you. Those are my questions.
Thank you very much. Thank you, Manager. Just folks know that I have Councillor Alex Wilson, Councillor Clark, followed by Councillor Critch. Councillor Alex Wilson.
Thank you. And through you, Chair, just one quick question from me to our Chief Medical Officer of Health, Dr. Elizabeth Richardson. Through you, Chair, I'm just wondering if we have considered extreme heat as a health hazard under the Health Promotion and Protection Act, or Protection and Promotion rather. Do we see extreme heat as a health hazard?
Thank you. Dr. Richardson.
Through you, Madam Chair. So would be two parts to that answer from my perspective. So in terms of it being a health hazard, yes, it is considered a health hazard. And so this is why we have under our health hazard program, we have Matt Lawson as the manager for that program, working on that issue and moving forward. Would we see that the order provisions that it would apply in a general way to heat? Generally, we don't use the HPPA for general conditions. Those are dealt with more through the kinds of processes and discussions that we're participating in right now and have done over time, and looking at various options to move things forward as we're doing. So that's generally the route through which we deal with extreme heat.
Councillor?
Thank you. Just a quick follow-up on that is, if we do have something that we consider to be a health hazard, there can be a flagging with the ministry and a conversation there under the Act. I'm just wondering, what have those conversations looked like, if at all, that they've happened when we have conversations from a public health perspective with the Ministry of Health as it pertains to extreme heat community-wide, but also specific to residential and institutional sites. A lack of air conditioning in long-term care homes became a very notable that we may throughout the pandemic have been communicating with the ministry on, just getting a sense of what of those communications have focused on so far, if they've existed. Thank you.
Thank you, Councillor. Is there someone who could step? Councillor Richardson?
I'll take that as a compliment. Elizabeth Richardson, Medical Officer of Health.
Did I call you Councillor?
You did.
Clear demotion. Sorry. Dr. Richardson.
When it comes to talking with the ministry, I mean, we have regular points where we have meetings with them and whatnot. I'm going to just turn to Matt and say, has there been any specific communication around treating heat as a health hazard or how we're managing heat of late? Matt, over to you.
Through the chair to Councillor Alex Wilson, the latest conversation point on this was May 3rd, I believe, when there was a heat webinar for health units and public health practitioners. Both Public Health Ontario and the Ministry of Health Ontario were there in attendance, and similar questions were being raised. To what extent does provincial legislation look to fold in heat? And no concrete answer was provided. It was just more so flagged as an issue, much like it's being raised at the meeting here today. So no broad policy forward on how to address that as a health hazard under the HPPA.
Thank you.
Thank you. Councillor Clark.
Thank you, Deputy Mayor. Do we, as a municipality, or perhaps even the hospitals, do we track heat-related emergencies for individuals who are going into the hospital?
Manager Lawson?
Through the chair to Councillor Clark, yes, locally we have two options for that we're exploring to track and get better information about the impact of heat on our population locally. One is through a real-time data network within our hospitals called the Acute Care Enhanced Surveillance System, or ACES is the acronym. It's still early days for developing this type of information, and these systems were developed more so as syndromic surveillance for infectious diseases, to learn when people were showing up, what was going around in the community. It's a little more challenging to develop modules of symptoms and signs to tease out things in the environment that are driving people to attend the hospital. But yes, in an answer, we do have a module for heat-related illness. The second source of data is we're working with counterparts in the EMS group, pardon me, to learn more about the distribution and frequency of ambulance calls to certain neighborhoods' addresses related to heat for situations where they're dispatched because people are suffering or their medical conditions have been aggravated due to heat. The information that was asked earlier by Councillor Pauls about the number of days and the frequency, that type of environmental data could also be assessed and cross-referenced with ambulance calls. Are they busier on heat-related days? That would associate heat events with greater effort and work for first responders and those in trouble.
Councillor.
Deputy Mayor, I think what I heard was that there's a program with the hospitals called ACEs, which is beginning to track these heat event issues for individuals, but that our EMS also tracks it. Can I ask, when did they begin tracking it, and do we have numbers from that?
Through the chair to Councillor Clark, EMS is not here today, and I don't have any numbers in front of me about that data.
Are you able to confirm when they began?
I do believe it's fairly recent. I don't have a history beyond the last, say, 5 years. I know just prior to pandemic years, we started to develop and get more active at developing our heat vulnerability map, which we're trying to take a lot of this data and apply it to a spatial sense for the city of Hamilton to understand where we need to, and can expect more cases of heat-related incidents.
Deputy Mayor, if it's appropriate, I would like to request that EMS provide that information to all councillors and to make it public. Can I ask, I see our heat emergency number is, I think it's 30 degrees, and the groups here before us today, CELA, ACORN, and the Hamilton Legal Clinic group, are advocating 26 degrees be designated as the threshold for a declaration. Can you indicate why we have such a high number as opposed to 26 degrees?
Dr. Richardson?
Through you, Madam Chair. So essentially, as I understand the question, Councillor Clark, and particularly as I was distracting Matt instead of him being able to listen to the question, he'll come back to it. But essentially with the 30 degrees, we're looking at outdoor temperatures in terms of their calling a heat event or an extreme heat event, whereas what ACORN's speaking to is indoor temperatures that would be provided. So Matt, do you want to pick up from there?
Thank you. Through the chair. That's exactly what my perception and take on that would be. The indoor temperature of 26 degrees, and in terms of calling a heat warning or an extended heat warning, is based upon the outdoor temperature of 31 degrees or higher for 2 consecutive days for a heat warning, or 3 consecutive days for an extended heat warning. And that daily temperature high of 31 degrees is also accompanied by less cooling off at night, so the temperature has to remain above 20 degrees at night.
Thank you. Deputy Mayor, I understand that response. Thank you very much. The next question would be with regards to the City of Hamilton and wellness checks. This is a term that I think Hamilton Police use. I'm not sure if our social services uses the same terminology, but do we have a register where residents could voluntarily, or their parents or family could voluntarily register individuals for wellness checks during a heat emergency?
Manager?
Through the chair to Councillor Clark, I'm not aware of any registry in the City of Hamilton currently. That is an objective that has been identified for working forward in the report. It's also one of the objectives and actions identified in the Climate Change Impact Adaptation Plan about further developing those networks. So we would be working with hopefully colleagues in other departments of the city in order to learn how to do that work. We have had a very first blush meeting with legal services about some of the legal considerations of the city running a registry for that purpose and the liabilities of that.
The liability seems to be more with the residents who may find themselves unable to handle a heat emergency. I'm not sure how the city operating a registry to assist people who are experiencing a heat stroke, how that could be a liability to the city. We're offering a service to those who are experiencing it. The last question that I have, and I'm not sure if legal is here, but I'd like to have some comments regarding the draft bylaw that was provided by CELA, the Legal Clinic, and ACORN. Have we looked at that? Has our staff looked at that bylaw, and can they provide some comments without getting into solicitor-client privilege? Just an overview of the bylaw.
Thank you, Councillor. I sought that information at the start of the meeting, whether legal was going to be present, and I was advised that they would not be present. I'd seek confirmation from that from Director McDonald.
Through the chair, Kevin McDonald, Director, Healthy Environments Division, to members of committee. No, our office hasn't reviewed the draft bylaw at this point in time, and with that, I'll defer to Monica Cirillo, Director of Licensing and Bylaw Services. I imagine her answer is the same.
Thank you. Through the chair, Monica Cirillo, Director of Licensing and Bylaw Services, echoing what Director McDonald said. We have not had an opportunity to review it.
Thank you, Councillor Clark.
I am disappointed that no one from legal is here. Thank you.
Indeed, thank you. Before we move on to the next speaker, Councillor Taddison, if I could have the prerogative of the chair further to Councillor Clark's question about EMS. So I heard a question that information is now outstanding. He has requested it. To Manager McDonald, did you say that EMS, our ambulatory services, ambulance, they are presently collecting data of their calls and cross-tabbing that with our heat days, or is it their intention to do so? Through the chair.
Through the chair, thank you very much for the question, Councillor. I believe Matt Lawson would have referenced this. I know that they're actually gathering the data. I don't know if they're actually cross-tabulating it as part of the heat mapping that Matt referenced, so I'll turn it to him.
Sorry, through the chair to Councillor, can you please repeat the question?
Yeah, I'm stealing Councillor Clark's line of questioning. You had mentioned in response to the councillor that ambulance services are starting to, when they're responding to calls, you said that they were noting those calls against declared heat advisory days, I thought. And are they doing that, or is it their intent to do so?
Through the chair to the councillor, that was my attempt, and I'm sorry if I was confusing about that. It was my attempt to just do a callback to the reference of the number of heat days that we get in a year that Councillor Pauls had asked, if that's being tabulated, recorded, and it is. So in terms of EMS collecting this data, some form or another, they are collecting data, but when they arrive at a scene, what is the call in response to? Like, why is somebody calling them there? And there is a way to try and attempt to take those calls and summarize, did heat have a role in this somehow? So that we're getting a number of, when EMS arrives. My earlier comment was a reference to, we could take the number of calls, like if we just got raw data about the number of emergency services calls by ambulance in a year, say 2022, and we take our heat date available, we could cross-reference that data and look for associations to observe whether or not on days where we have heat warnings that we see a higher number of ambulance calls for those types of illness situations that are being reported through 911.
Thank you. My apologies to the colleagues seeking confirmation on that. Councillor Taddison.
Just a question to Manager Matt Lawson. In determining, well, actually in creating the community heat response plan, you mentioned that they're assessing maximum thresholds. Can you do a deeper dive into what determines the maximum thresholds for heat?
Through the chair to the counselor, can I request just more clarification, counselor, on which maximum threshold you're referring to?
Well, I have it written down that you used the terminology that you were in the process of determining maximum thresholds for heat that were, I guess, in determining what would be adverse effects on human health. So what are some of those things that we're looking at that are determining the maximum thresholds?
Through the chair to the counselor, I think I understand your question. Thank you, counselor. And the related, that would be work through a literature review, much similar to the work that has just been completed. And a report will be coming forward related to the cold alert threshold that I believe is scheduled for June's Public Health Committee meeting. That type of work would be a literature review, and it would be looking at systematic reviews that are trying to identify what does the scientific literature say about how the heat can, or how the body, human body, adapts, responds to heat, and where a critical temperature exists. My understanding of this work so far is that there is a much broader distribution in the way the body reacts to heat than it does in cold, so it's a little harder to determine a point where you have to say enough is enough. It has to cool down. I believe, as I said before, though, that would be forward-going work with a literature review on determining that threshold.
Would we be using data such as that gathered by our EMS services in order to determine that threshold, or would just be a literature review?
Thank you. Through the chair.
Through the chair to the counselor, I think the report back would incorporate all of that data for your consideration. So it would include what the literature review finds, plus any local data that we can find that would be helpful toward the assessment and understanding of this problem and its impact.
Okay, thank you. Also, the Hamilton Community Heat Response is full of language that talks about vulnerable populations. So can I ask, what specifically are some recommendations or steps that will address the needs of residents with mobility issues and other physical limitations that make them very vulnerable to heat events?
Thank you.
Through the chair to the counselor, one of the objectives moving forward is to look for how the city can respond to, in this meeting already this morning, one of the examples was a vulnerable persons registry. That would be one idea of having individuals who may need that extra plan so when a heat warning or extended heat warning is issued, that they would be checked in on, and there would be awareness of individuals who have self-identified as being vulnerable to be notified. As well, additional work would be happening with landlords and trying to establish in community groups, necessarily, it doesn't have to be landlords, within rental buildings who are interested in establishing neighbor-to-neighbor support networks, so that if you are in a heat warning, somebody within the building is helping take care of their neighbors by either knocking on the door and doing the wellness check themselves or placing a phone call. Those are two of the main functions we see for adapting to protecting our most vulnerable. The literature review on interventions may also bring forward additional steps that can be taken. So we'll wait that work to see if anything has been identified.
Thank you. Councillor.
Thank you, Manager. No more questions.
Thank you. I have Councillor Pauls, followed by Councillor Beattie, Councillor Cretch. Councillor Pauls.
Thank you, and through the chair. I understand the heat regulation we have, making sure everybody has heat. I understand that. I'm just wondering, who regulates the air conditioner? Who regulates the air conditioner? Does ours? Will we do that?
Who regulates the air conditioner?
Yeah, individual. We have an apartment, so we regulate what the air conditioner should be at, the temperature in those apartments?
Through the chair to the counselor, no. Currently, there is no bylaw that exists or legislation that says that we have a limit or an expectation that air conditioning is provided. It's only a low temperature existing right now for the maximum bylaw.
So, so if we do a bylaw, will we have to regulate the temperature of each apartment?
Yes, through the chair to the councillor, the intention of the bylaw would be to put a limit in, a temperature limit, such that the indoor air temperature would not exceed a limit. In the examples provided related to, I believe in the notice of motion, 26 degrees has been spoken about. And so if a rental unit was to go above 26 degrees, then it would be considered to be non-compliant with that bylaw.
Thank you for that. And so we will regulate, just like we regulate the heat. Is that right?
Through the chair to the councillor, I'd like to pass it over to Director Monica Suriello for comment.
Thank you.
Through the chair to the councillor, yes, we would be regulating it the same way. So municipal law enforcement would play a role. We would attend the different units if we received a complaint, and we would use officer discretion to choose which next steps that may be. That could be anything from issuing a compliance notice or order to comply, requiring the landlords to go in, fix the air conditioner if it's not up to the appropriate temperature.
Thank you for that. The reason I'm asking that is, even in the winter, I have calls from residents saying that the heat is not warm enough and they want to increase it. But we have a standard. And the reason I'm also asking that, because residents have different threshold of comfort and discomfort. So for me, how do we regulate somebody's discomfort from the heat where, I want to tell you too, my mother never wanted air conditioning in the home. She was older. We grew up in Italy. We just took the heat. Every time I had put the air conditioner, she would be upset because she caught a cold. I'm not saying, it's not that I'm against this. I want to be clear. I just want the threshold of different comfort for different people. How do we regulate that?
So I think staff have said there would be the threshold would be a base number. In this case,
right.
what some of our delegates suggested, 26. And then that would be the threshold upon which, if you are in compliance or not compliance. And I don't know if anyone would like to add. Manager Lawson.
Thank you. Through the chair to Councillor Pauls. As was earlier mentioned, and to your point is definitely taken, that there is a distribution of different preferences for what makes somebody comfortable. And the challenge here is to identify a standard temperature that is protective of health for the most people. And so I hope that might answer your question.
Yes, it does. It really does. I wanted to ask our medical officer, but this is silly. My mom used to say every time the air conditioner was on, she had a cold. Is there anything that putting too much air causes discomfort or causes anything? I just threw the medical officer.
The question is, does air conditioning cause influenza?
Could cause any issue as well.
Through you, Madam Chair. So the issues of comfort are real. Different people experience things differently. People acclimate as well to different temperatures, and so that takes time to develop. In terms of, does air conditioning cause anything in terms of an illness? In general, no. If it's well maintained, all that sort of thing. But there are, of course, issues if units aren't well maintained. We've seen those in the past. But we also have other standards available to us around the maintenance of heating towers and such.
Thank you for that. I got two more questions, if I may, through the chair.
Yep,
one thing is, when we implement something, I'm just wondering who takes the cost. I'm thinking of apartment building who has to implement this. Who do you think picks up the cost? The landlords or the tenants?
So, Manager Lawson, do you have an opinion on that?
Through the chair to the councillor, I think it would refer back to the relationship of what does the tenancy agreement state. If the tenancy agreement states that the landlord will be paying for the utilities, then the landlord will be paying that cost. If the tenant is responsible for their own utilities, they would be paying for that cost themselves.
And
Thank you.
that's a good answer. I understand that. But what about when we demand some landlords, they have to do it, where will they pass on their deficit? Like, you know, it's going to cost a lot. Can they raise the rent?
Through the chair to the councillor, I'm not fully aware of that answer. Just being very forthright with you about what the landlord's options legally may do about the rent increases. But it would be not surprising if some landlords were to find a way to accommodate the increased cost by perhaps downloading it onto the tenant.
And that's what I'm afraid of. My last question through the chair, back to Councillor Nan about the fountain. When we know, how many days prior do we know there's going to be a heat wave? When do we alert?
Through the chair to the councillor, good question, councillor. So within this, within Ontario now, we do have the heat warning information system, which is a partnership between Environment Canada, the Ontario Ministry of Health, local health units in local municipalities and regional governments. And Environment Canada, so the Canadian Weather Office of Government of Canada, is the entity that does our forecasting to look for heat events as part of a standardized structure. So when we're speaking about standards of temperature this way, the heat warning and the extended heat warning criteria have become standardized here in Ontario. That's a step forward in this. I have been working in this capacity about 15 years, and it was maybe only 8 years ago that it became standardized. Previously, you might have one health unit who's declared a heat alert right next to another health unit where it was very similar feeling to the people out in the community, but they weren't in a heat alert. But now we do have standards here. And so related to that point, that is where the standardization of the response would be. And I'm sorry, is there a further question to that, or have I answered the question?
The reason I'm asking, Councillor Nana asked about water fountains. So we know ahead of time, like in April, we had a couple of hot days. We know ahead of time that there's going to be a heat wave. Education is the best medicine, I think, to tell people, bring your water. The fountains aren't open, so bring your water with you. I heard Kara's answer. It would cost a lot to turn them on and then turn them off because of the issues. So for me, when we do an extreme event, to say it's going to be hot this weekend, 50 degrees, 40 degrees, whatever you want to say, please bring water with you. It's April. The fountains are open. So I think education is important to that timeline.
Councillor, you're at your 5. Just
okay, just the last, because if we start saying in April it's going to be hot, we're going to turn water fountain, what about the pools? What about other things? So we have to be careful, and education is the best
This
medicine.
is a time for questions. Thank you. Councillor Beattie.
Thank you, Chair, and through you, I just want to first state that I have cost-related questions also, but they're different, and they're not meant to be seen as combative in any way. I'm just front-loading that. But I did have questions to build upon some of the lines of questioning that Councillor Clark was asking earlier in regards to EMS response to people that are in distress with heat-related illness, I'll call it. I'd build on and ask, I would ask if it is also possible to seek the responses from other first responders in addition to just our paramedic service. I know that our fire service does respond to offer medical assists. Police sometimes are involved with responding as well. And I'm wondering through you, Chair, if it's possible as part of the work that's being done through the EMS service to also track other first responder agencies that are responding to these heat-related illnesses as well.
Thank you. I think, Councillor Clark, if I could ask, you're going to be bringing a motion forward, formalizing that ask? It's in Councillor Crutch's draft motion? Okay. Does that answer your question?
Perfect. And then to go one further step with related costs, there is a valid question, who is going to incur the cost of these upgrades, but I would hypothesize that we're already incurring costs through inaction, and I would like to understand if the data that would come back from our first responders would have dollar amounts attached to them so that we can examine what the cost to the municipality currently is for first responders that are attending to residents that are in heat distress, and if that could be collated as part of the discussion.
Thank you. So the cost of having to respond to these heat-related emergencies. I think there's some conferencing going on in the bench, so if I could just get a second.
Just as long as you've stopped my clock in the meantime.
What clock? Manager Lawson or Dr. Richardson, would you be able to comment on that, please?
Through you, Madam Chair, to include costing data generally takes longer time to get cost estimates and that sort of thing associated with it. I'm just trying to think through the feasibility of getting things done in a timely way. We can look at that and see what we can do, but I would not, we might end up doing that in 2 stages rather than do that all at once.
Councillor Beattie.
Thank you, Chief Medical Officer. Appreciate that it does take some extra time, but I do feel very strongly that it would be foundational to our decision making, even if it was generalized, to allow us to have some form of data that might aid us in our future decision making. Chair, I would also wonder, we had conversations about the impact on our local emergency units. So responding to heat emergencies at a resident's location when they're in distress is one thing, but then we have to often transport them to our already overcrowded emergency rooms. Again, there's an impact on the overall system that takes place as a result. I'm wondering, again, if we are able to track further the cost and the impact on our local emergency rooms during these heat emergencies and heat events, because I think that would be important information to have as well.
Thank you. Dr. Richardson.
Through you, Madam Chair, the data, again, that Matt described earlier about the adverse events monitoring system, we can look at using it, and that will give us, that generally draws from emergency department data. To get further data than that, we're back to the issue where we don't have a system right now that provides us all of that, and it takes time to devise and break down, for example, how much of cardiac events is actually due to heat, what's the correlation. That's a much longer exercise. And then to cost, again, that on top, unless there's some actual literature that already exists that relates to that we can use as well-prepared scientific literature. I would turn to that if that was available to us first, rather than looking at all the costing locally. But that's stuff we can look into as we do that evidence review as we go forward.
Councillor Beattie.
Thank you, Chair. Thank you for the answer, Chief Medical Officer. I'm just trying to pivot our thinking towards preventative cost versus reactive cost, which is what we're doing right now. We're paying for the effect. If we can mitigate the effect, I think that there could actually be a proven case for cost savings for taxpayers in the long run. Along the similar line, we've heard from delegates today that the impact on them is affecting their ability, could be affecting their ability to work. I'm wondering if it's possible, and I don't know who to ask this, Chair, but if it's possible to have an estimate of the economic impact on our local Hamilton economy when we have a workforce that's unable to go to work and be gainfully employed and they're missing days. Our local employers are thus impacted negatively with productivity loss of their own. Is there an estimate or a model that would give us insight into what the economic impact of the heat emergencies currently is?
Thank you. I'm going to turn to Dr. Richardson, but I imagine that would be maybe part of the literature review. I know there is a study out of the University of Waterloo that is estimating by the end of this century, $23.5 billion will be expended as a consequence of heat-related deaths, loss of productivity. Let's see, estimates indicate that under a high emissions scenario, climate change could lead to a loss of 128 million work hours annually by the end of the century, and the hours worked by 62,000 full-time employees at a cost of $15 billion. So I'm sure that can be included in the study. It was similarly included in some of our works with respect to sidewalk slip and falls. Estimates of cost at the emergency room and estimates the cost of not showing up to work because you're injured. Thank you for that. And I will take that as a yes to count. Dr. Richardson, you'll be able to include that?
Through you, Madam Chair, we will, and indeed the center that you're speaking to is one of the key sources.
Councillor Beattie?
Thank you, and I look forward to that information. I'm just trying to ensure that it would be something that would offer a local Hamilton context.
Hamilton specific.
Yes, please.
Through you, Madam Chair, in terms of actually measuring directly Hamilton context, that's takes a huge amount of effort and study to do, but in terms of then extrapolating what has been found through those studies to understand what that means for Hamilton, that's work we can do.
Thank you. Councillor Beattie.
I think I may just be going along a different line. This may be an economic development question. I mean, we have folks from that division that are interfacing with employers across the city on a regular basis, gauging, polling, asking questions, and I don't want to make more work for them, and they're doing a lot of work already, but I'm wondering if there's a multidisciplinary approach that would enable those who are already doing that kind of work to make additional inquiries and gather that data as well. That was more along my lines of thinking. Through you, Chair.
Thank you. So a cross-departmental review of consideration of a full assessment of costs, hypothetical and otherwise, could be part of the work. Please and thank you.
Through you, Madam Chair, we can reach out to our colleagues and see what they are doing currently and or what comments they might be able to provide.
Thank you, Councillor Beattie. Thumbs up from Councillor Beattie. No further speakers.